Assalamu alaikum wa rahmatullahi wa barakatuhu. Welcome back to Health Issues. My name is Dr. Munir Avalia, and I'm a practicing dental surgeon in the United Kingdom. But some of you may be aware that I also practice hijama. Inshallah, in today's program, I'd like to go further into the field of dentistry, because this is my area of specialty, and look specifically at signs and symptoms of different dental diseases, so that you may be able to pick up on them and visit your dentist treated before the problem gets worse. And as I mentioned before, very important for every one of us to visit our doctor, visit our dentist on a regular basis. This is why sometimes we see in the United Kingdom it's recommended 6 monthly, yearly, every 2 years to visit your dentist, so that they can identify any areas of problem, any disease, so that it can be treated before the problem gets worse and before you experience the pain. Because I'm sure many of you have seen maybe members of your family, your friends, or even yourself experience severe dental pain. And it can be very traumatizing for you. Not only the pain you experience then, but then having to go to the dentist who you've maybe feared having to go to, then having to treat you. It can be a very traumatic experience, especially if this occurs as a child. Therefore, we need to prevent these things occurring. But let's look at some of the signs and symptoms of some of the disease. The primary one is something called caries. Okay, caries, if we think of it very simply, as the little holes that come in the mouth. So for example, teeth are generally white, and you see these little areas of black that can develop into these holes. Some of it may be staining, but if we look specifically at what we're discussing as caries, the signs and symptoms. The signs is what we see. We see the blackness, the discoloration. There may be obviously difference. Someone has something called staining. This is if someone is having a diet that has very tannic or staining foods, for example curries, tea and coffee. These things cause staining. So this is a different issue. But other side, we look at something called symptoms, things that we feel, the things that you feel as individuals. Maybe you're drinking something cold, having some ice cream, you feel sharp pain. This is because the outer layer, the white outer layer of the tooth, has lost some of the mineral, which has now entered the area. So we've gone through the enamel, which is the outer part of the tooth, the white area, into something called the dentine, that gives the teeth yellow color. And this dentine has all these little nerve fibers that what gives us sensation. So when you have the cold, something cold, the ice cream, we get a sharp taste, or the cold air, the cold wind. Alhamdulillah, you don't experience this in Egypt. It's nice warm weather, but many patients experience this in colder climate. So this is the signs and symptoms. So when you're feeling these things, it's very important for you to try and visit your dentist so that they can give you a preventive regime. And inshallah, again, I will reiterate this, because dental disease is throughout the world. There is nowhere in the world that does not suffer from this. There may be areas in the world where they don't suffer from specific medical conditions, but in terms of dentistry and dental decay and dental disease, throughout the world, this is a problem for mankind. Inshallah, we need to look at the ways that we can prevent these problems. It's better to fight the disease at the beginning. Don't let the army of bacteria cause the decay, cause the holes, cause the gum disease. Now, the other topic we want to look at today is of the gum disease. And something very interesting I want to tie into the Islamic concept of using the miswak. Those individuals who are in the field of periodontics, which is perio, means surrounding structures of the teeth. So periodontics is a specialist field in those who treat gum disease and treat those surrounding tissues like the bone that surround the teeth. And if we look on the teeth, something called the biofilm builds up just after several minutes, 1 minute, 2 minutes, after brushing the teeth using the miswak or using your normal brush. This very small film builds up on the teeth. And therefore, if you're constantly using the miswak, you're constantly disrupting this collection of these cells. And therefore, because they're disrupted, they're unable to cause the disease. And this is why when I see a lot of my Muslim patients that are using the miswak, one of the reasons why they're not getting the dental disease, not only because maybe their diets may be assisting them, but in terms of specifically the gum disease, they're constantly disrupting this film, this biofilm. So not allowing the bacteria time to proliferate or get larger and cause the disease. Now, what are the signs and symptoms? The signs, when you're brushing your teeth, there will be bleeding. So you will see this when you rinse out and spit, you'll see the blood. Now many people fear this because they feel that the bleeding, if they brush, is going to cause more detriment. But it's actually the other way around. It's actually opposite. Therefore, you need to brush your teeth, keep brushing them until the bleeding drops. Now initially, the bleeding will increase because all the bacteria and the plaque is stuck around your teeth. And maybe something called calculus. Calculus is whereby the plaque, which is the soft matrix of the bacteria and the food substance, if it stays on your teeth for a long period of time, becomes something called tartar, and this, or calculus, and this needs to be removed by a dentist. You cannot brush this off with your toothbrush. What are the symptoms that one experiences? Again, people feel pain in the gums, they don't want to brush them, it hurts them a lot. They may suffer from dental abscesses, they may suffer from a bad odor, bad smell. So these are some of the signs and symptoms of the gum disease. And this can be very debilitating because if you have bleeding gums, very bad malodor, people don't like to go into public, maybe their job involves speaking with people. You know, some people have lost their jobs over these issues because they're so scared of going to the dentist to have the treatment, and they think brushing the teeth is going to cause them more problems. But it's the opposite way around. So like I said, the sugar causes the decay, but it's the frequency of sugar. And again, frequency of brushing. But alhamdulillah, when we make wudu for the salah, before the prayers, we are gargling our mouths. So 5 times a day, the actual process of gargling removes some of these larger particles and larger debris. And as I said, gum disease usually starts in between the teeth, areas where we can't get our toothbrush. So very important to prevent the gum disease is using floss, using these little toothpicks. Not vigorously, but to remove the plaque, the soft substrate of bacteria and food particles which cause the gum disease. Now unfortunately, I see myself that even in the West, we are over-prescribing antibiotics. So a lot of times you will visit your dentist and maybe they will feel that you need antibiotics, wrongly or rightly. But my personal opinion is that we need to prevent these things, prevent the disease, so that we don't need to use the antibiotics. Because the antibiotics is part of the cure, it's not the whole cure. The cure, if I speak specifically about dentistry, is removing the problem. So for example, if you have an infected tooth, if the decay, the hole, goes through the white portion of the tooth, the enamel, goes into the yellow portion, the dentine, the sensitive bit, and then the nerve, the pulp is nearby. So if this decayed hole gets into the nerve, this is when we start getting pain. People get constant pain every time they chew, every time they eat, abscesses. And then a whole triage of treatments is required. That is traumatic to the patient who is already scared or traumatized going to the dentist. And therefore you may need something called a root canal treatment. Root canal is whereby you're cleaning out the infected portion of the tooth, and then after this you may require a filling or a crown. And obviously these different aspects you will consult your dentist about. But it may come to a stage where the hole has got so big there is not much structure left of the tooth, and the tooth may need to be removed. And the way I describe this to patients is like a house. Many patients will come to me and say, oh please try your best. And I'll say, even if I try my best, I cannot guarantee that this filling or this crown will succeed, because like a house, it has 4 walls. If 3 of the walls are gone, how can I put the roof on? And if we think of the filling or the crown as the roof, it's impossible. So we need to make a structure. Sometimes we have to build a structure. If there is, we need to have the root of the tooth. The foundations have to be there. If there's no foundation of the teeth, then how can we build up these things? So you may hear, when you go to the dentist, they talk about something called post and core. This is whereby the infected central portion of the tooth is removed. And then because there is not enough structure of the tooth and the dentist is trying to build it up, they place a post into the tooth. This may be of different materials, gold, silver, there are many types. And then once the post is in there, core or a foundation, the walls are rebuilt. And hence then after this, the crown can be placed. Now a difference between a crown and a bridge, a crown is usually what we call a single unit. So it's replacing on top of a single tooth that has been badly broken down. A bridge, just like we think of a bridge, we have the land here and we have the land here, and we have the bridge over it. So meaning we have a tooth here, we have a tooth here, and here is a gap, and somebody requires a replacement of the gap. There are again many different ways of replacing the gaps, but I'm talking specifically about the difference between a crown and a bridge. So you may have a crown placed on this tooth, which is the land here, crown placed on the tooth, which is the land here, and then here an artificial, the bridge, the artificial tooth sits, which is connected to these two other teeth. But again, as I say, you will replacement of teeth, many things. Some people don't like to replace it, especially if it's in the back area of the mouth. It's not essential. If you can function, you can eat well. But obviously the front area, if someone has lost a tooth, then it's going to be aesthetics, meaning you're not going to want to walk around without having your front teeth. It'd be very embarrassing for most of us. Another concept is something called an implant. This is whereby like a titanium screw placed inside the bone. It sounds very traumatic, but trust me, many patients having this procedure done. And it is less traumatic because to put a bridge on, you need to cut sometimes, like you need to prepare either side of the river, river banks, to put the bridge on. You may need to cut down the teeth, which causes problems within itself. So sometimes people go for an implant, which is a screw, goes into the gap, and then on top of this, the artificial tooth or the artificial crown is placed onto it. I'd like to thank you for joining us today. Jazakallahu khairan, wassalamu alaikum wa rahmatullahi wa barakatuhu. Assalamu alaikum wa rahmatullahi wa barakatuhu. Welcome to today's issue of health. My name is Dr. Munir Avalia. I will be your host today, and I'm a practicing dental surgeon. Inshallah, today I want to look at some of the differences of the Islamic fasting as compared to fasting in other religions and maybe fasting prescribed by non-Muslim medical practitioners. What is the difference and how can this, or does this benefit us in any way as Muslims? If we look at the world today, a lot of us are overeating, overindulging, as we have discussed before, many reasons for this. Sedentary lifestyle, sitting in front of the TV, in front of the couch, eating all this junky food. And then our body craves something. Our body craves the need to exercise. So what do? We end up eating all this food, spending all the money on this, maybe even some of us wasting it. May Allah prevent us from this. Then we need to go to the gym. So we pay a lot of money going to the gym. Every month we fork out some money, get a personal trainer. Maybe we start having special diet shakes we need to use. All of this because of overindulgence, eating too much, diet, everything again related to the body, the whole system of the body. Overeating causing the diseases that we see today, cardiovascular disease, heart disease, diabetes, causing problems for women in pregnancy. As we mentioned earlier, the highest rate of obesity today is not in the Western world, it's not in America, it's in the Arab world. And this is very disturbing for us as Muslims because we should be those who lead a balanced lifestyle in anything in life. No one is saying don't eat any fried chicken ever. No one is saying don't eat any sweets ever. But everything we need to have a balance. And just like the Prophet ﷺ led his life was a balance of efficiency, that he lived with the world, lived with the people, lived with the animals and the plants and everything within it in a balance. Because this is the way Allah subhanahu wa ta'ala has created the world. Like we see the moon and the stars and the sun, everything in equal balance to benefit us in this dunya. And inshallah, this way we can worship our Creator with full energy and full alertness to gain us the ultimate success, which is not having the biggest car in this world or the biggest house in the world, but the ultimate success, inshallah, is gaining the pleasure of our Lord and through His mercy allowing Him to enter us into the paradise, inshallah. If we look at specifically now the differences between Islamic fasting and fasting of other cultures. For example, we mentioned in Christianity, Lent, in Hinduism, abstaining from meat products or having a vegetarian diet for a certain period of time. Fasting does not cause malnutrition in Ramadan. Islamic fasting, now I'm not saying necessarily that other ones cause malnutrition as per se, but if you, for example, constantly keep yourself away from meat, we know in Islam it is not forbidden to eat meat. Obviously there is forbidden meats that we cannot eat, but meat has energy for us, it is allowed for us. So it does cause malnutrition. You need the protein, you need the different sources of goodness to replenish the body. And this was confirmed by a professor in medical physiology in 1974. when he conducted a dietary analysis of Muslim students of North Dakota in the United States. And he showed that the calorie intake of Muslim students during fasting was 2/3 of the recommended daily amounts. So this is not a malnutrition, but just obviously a reduction in the amount that they were consuming, quite rightly, because of the period of time for them to eat was reduced. Now, fasting in Ramadan is voluntarily undertaken. Although it is obligatory upon us, it is not imposed onto us by a physician, but it is imposed onto us by our Creator, Allah subhanahu wa ta'ala. Whereas the other diets that utilize some sort of fasting from specific foods and drinks, they're usually prescribed by a doctor, not by our Creator. And as we mentioned earlier, if you think of the body like a car, the engine being the heart, the wheels being the legs and the hands, that the maker of the car, he knows which fuel to give you. Like Allah subhanahu wa ta'ala, he knows which food is good for us and which liquids we require to replenish our body so that we can live a happy, sustained life, so that we can worship ultimately our Creator and enter the heaven, inshallah. Now, another difference is that with the prescribed fast, Muslims are not subjected to a diet of selective food only. Just like we mentioned before, it's a balance of everything. There is meat in it, there is fish in it, there is vegetables, plants, all these different things. So taking an early breakfast before the dawn and taking the meal once the sun has set, so that the energy levels are sustained throughout the period of fasting. And as we mentioned earlier, in some of the countries of the world, maybe in the United Kingdom at the moment, the period of fast is quite prolonged. So we need to eat of those things that will nourish us for the sustained time. Others will become very tired and lose our energy when we're conducting our daily activities. Ramadan also is an exercise in self-discipline. So it's not only the physical abstainment from food and water, but it is rather an exercise in self-discipline. And for those, for example, someone who is a smoker, they may have been smoking their whole lives, but in this month, in the month of Ramadan, due to their God-fearingness, they will stop this. And inshallah, we encourage our brothers and sisters, whoever is indulging in maybe smoking and that, try and eliminate this from yourself. It can be hard, so there are centers and doctors that specifically train to assist you. And inshallah, you will feel the great benefits of this. And just one point to raise, when someone stops smoking, related back to oral health and dentistry, they will find that their gums bleed a lot. Now the reason this is because some of the nicotine and the cells in the smoke, they suppress the blood getting to the vessels that supply sensation to the gums. And what happens is when you stop smoking, these channels are reopened. Some of the channels, the small capillaries and blood vessels that are little branches off the main veins of the trees, they become revitalized, replenished. So initially they find a lot of bleeding. But don't worry, this is actually a good sign because it means the blood, and the blood which carries the good things, the good white cells and the red cells, to fight off the disease and the bacteria, will again benefit you. And this is one thing we see in those who are smokers, they have advanced gum problems. Because the body, its own mechanisms, self-defense mechanisms, unable to work, unable to defend. But bleeding will increase, but over time, inshallah, the gums will get better. You will find there will be less staining in the mouth, less of a bad smell, less of a malodor. And the amount of money you save, the cigarettes are very expensive. You could save plenty of money. And you could benefit not only yourself, but benefit giving more charity, inshallah, to help those who are in need, inshallah. I want to specifically look at the physiological effect of fasting in Ramadan. And it's, people describe fasting as not only the physical well-being, but some sort of tranquility. Because this is one of the only worships that God only knows, really. Because you could be at work, no one may know. But other acts of worship, when you're actually physically praying or you go on Hajj, these things are seen by people. But fasting is something between you and God. Obviously, you know, if you're a Muslim in a Muslim household, your family's going to know. The wider Muslim community can know. But for those of us living maybe in the West, this is something, a close link between you and God. It's not to say that people who live in the Arab or the Muslim communities don't have this link. But maybe when they go to work and in the society knows that, you know, it's Ramadan, so people are fasting. Hamza, the other issue we want to look at today is maybe some specific ailments or diseases. Just to give you some advice, is I'm not a medical doctor, I'm a dental surgeon, so the advice I'm giving you is general. And I would advise everybody, anyone with specific ailments and diseases, to consult their physician, consult their general medical practitioner or specialist to gain their benefit so that no harm is caused to the individual. If we look at someone with hypertension, so hyper, if you think of a child that's very hyper, high blood pressure, and cardiac patients, patients with heart troubles, fasting is actually beneficial for them. Now, I'm not saying that every patient who has very, very high blood pressure, and there's different reasons for heart troubles, many causes, that they should just go away and fast if they've never fasted before. Again, they should seek advice from the doctor. But it has been found that those patients who have high blood pressure, a lot of the causes in the world today of high blood pressure is because of the food we intake. So very high salty things, a lot of sugar in the diet, frequency of eating, lack of exercise, smoking. So if we can reduce these things and even fast will actually help us to cleanse the body, clean the system and reduce this blood pressure. So they may even get benefit from this. It's very important for people with high blood pressure to maybe consider these things. Again, with hijama, some of my patients I've seen, they've been visiting their doctor for years and they're given antihypertensive, so drugs that reduce the blood pressure. And they may be effective for a period of time. Maybe they have to constantly change them, they don't benefit them. But some of my patients, they come regularly for the hijama specifically. It's withdrawing the blood. Automatically you find a reduction in blood pressure. But over time, the body yearns for this reduction so that it can maintain and stabilize this. So it actually benefits them. So I would advise anybody who's got these problems, seek those who have knowledge in this area, see your doctor, see a hijama specialist, and get advice from them, inshallah. Other things that we suffer from, for example, migraines, headaches. Again, people suffering from severe migraines may be taking constant, regular medications. It's not to say that you just suddenly stop the medication and just fast and do the hijama. Maybe a gradual process of reducing these things in consultation with your doctor. But during the fasting, we may see that people, due to dehydration, low blood sugars, these issues may be exacerbated, or they may even start in people who are normally fit and well. You know, we all maybe feel this during Ramadan. During the mid-period of Ramadan, we become a bit lethargic and tired. And, you know, the dropping in the sugar levels in the body. And we need to reattain this and replenish the system, inshallah. Now, pregnancy in women, does this prevent the woman from fasting? Again, it's advisable to ask the shuyukh and those who have knowledge in this area. But if we're looking from a specific medical reasoning, pregnancy is not a medical disease. Hence, it will affect different women in different ways. Now, obviously, during this time, the child is growing, and not only energy is required for the mother, but energy is required for the child. So, it may be wise during the pregnancy, especially in the first trimester. So, if we divide the pregnancy in 9 months, the first trimester, the first third, is when the fetus is requiring a lot of energy and a lot of sustenance for it to grow. And hence, at this period of time, it may not be wise. But again, towards the end, the mother may become tired. A lot of energy is consumed from the child, from the mother. And I would like to thank you for joining us for this episode. Inshallah, we will cover some more specific conditions in later programs. Wa jazakallahu khairan. Wassalamu alaikum wa rahmatullahi wa barakatuh.